I'm curious, from your perspective, working with women on their health issues for decades, where do you see money and medicine intersecting in the lives of your patients? And how does that impact you, if at all?
It's a great question. It definitely impacts their care. So right now, the health crisis is getting worse. There are very large deductibles for a lot of women. So in our practice, we take insurance. So if they have a $5,000 deductible, they may not get the care because, we're paying for the equipment to diagnose their abnormal bleeding or whatever it is that they need, and they may need medications that aren't covered. And so we do our best to help them with that. So financial issues definitely impact, but in the longer term, sometimes people say, oh, I can't miss work. I have family obligations. But then those decisions to not diagnose early or screen early can come and get them later, because if they don't diagnose the cancer early, if they have it, then they're going to spend a lot of time away from their family and work getting advanced treatment. So it's really important to understand how to screen for things and diagnose them early, and also understand prevention measures, and you can pick what works for your life. But I try to start even when women are in their 20s. I say to them, look, you want to get enough calcium in your foods so you build strong bones, because this is when your bones are going to be the strongest. And when you get into your late 30s and 40s and beyond, you're going to start losing bones. So these are the things you can do now. And probably most of them think, oh, for God's sake, would she bother me with that? But some people get it. And I try to do that, to do the lifestyle things that help
I
women.
think that's really
But it does
important. It's
impact the
sort of like in our
finances.
line of business with personal finance, you save and invest early because there's a compounding effect.
Absolutely.
This
And I did do that. My first job, I was working very long hours. I saved a ton. I really saved a lot because I got, I was single. I got a few things, but I didn't spend much money on anything. So I saved a
You
lot.
knew the value of
And
compounding.
with your help, you want to bank so you have more health span, not just lifespan. So, people look at longevity, but you want to have quality years. You don't want to just have, I don't think most of us want to have longevity without the quality.
As you look at the healthcare landscape and you think about money, what one money wish would you have to change the area in which you work?
Well, I wish women didn't have these large deductibles. So sometimes I'll say, gee, I really would like an ultrasound to check on your ovaries and your uterus so we can understand more what's going on. And they'll say, there's a $500 deductible and I don't have it and I'm not going to do it. So I usually try to work around. I'll say, okay, I understand. We'll do these other things. And when you can, it would be, but women shouldn't have to make those decisions. I mean, that doesn't make any sense. If you're paying insurance premiums, but you can't get your screening test or diagnostic tests, you're really not getting care. And people do it because it's a very difficult economy now. I mean, you know more about it than, of course, people are going to pick insurance plans with a lower premium, but then they have the higher deductible. So it's very difficult for
You
people.
need people to
So we really need to fix that so they have preventive care and they have access to the services they need to stay healthy, because it costs the system more when you don't do that. So if you don't do the screening, it costs everybody more, because then you're paying for the emergency
That's
room
right.
visits and the advanced surgery and chemo and radiation. So it's not to anyone's benefit, the woman or her family or
Or the insurance
the
company,
system, to do
actually,
that.
right?
Exactly, exactly. That's a whole other discussion,
It's a
right?
big, important discussion.
It's an important discussion, and I feel very badly. I do have colleagues that have gone to concierge medicine so they can give the time that they want and give the, not be bound by that. But where I am, the population would not be served well by that. So I don't do that at this time. Again, it's another financial decision. So we try to give the very high level of care. We have very good staff, supportive support staff, but it is very challenging to run a medical practice now because the reimbursements are not proportional to the cost of doing business. So you can't just send a bill. Like when my mother was in practice, it was $1 for an injection and $2 for the visit, or whatever it was. And you didn't have to bill insurance unless you delivered a baby, had your baby at the hospital or something. But now you have to send claims and it has to go through a clearinghouse. So you have to pay for the clearinghouse, you have to pay for the biller, and there's electronic submissions and all kinds of bells and whistles. So it isn't just what the doctor's charging, it's all these expenses
All the
that
infrastructure.
increase.
Yeah, it costs.
Exactly. There's a tremendous infrastructure. So it's a complicated system. And it's very unfortunate because people think doctors are charging too much, but it's what we're paying. We have to cover those costs.
Right.
It's not going to us. It's going to the hospitals and the clearinghouses and so those things are part of the high cost that people don't realize.
Yeah, it's
So that's
definitely an area
unfortunate.
that's primed for reimagination.
Oh,
Yes, that's a lovely way to put it. Reimagination is good. We don't have much imagination going on in healthcare right now.